We have heard a lot about monkeypox coming in. It is going global, and it is actually arriving in India, and everyone wants to know what exactly it is. We were within the pandemic of the COVID-19, and everyone is worried that is monkeypox going to be a next pandemic? Is it a threat to us? So let us understand what monkeypox is. The monkeypox is a viral zoonotic disease that occurs primarily in tropical rainforest areas of the Central and the West Africa, and is occasionally exported to the other regions of the world. It started in a few countries in Central Africa and the Western Africa, and there is only, before this, there was only one outbreak outside Africa was reported. That was 71 cases in USA. That was in 2003. This actually happened because there were some pets which were imported from Central Africa to USA, and the pets were kept together, and then they caught the disease, and then from those pets it was transmitted to the human beings, and that is how the monkeypox spread in USA in 2003. It is detected in squirrels, Gambian poached rats, dormice, and some species of monkeys. So it is mostly seen in rodents and very few species of monkeys. It was first discovered in 1958 when two outbreaks of pox-like diseases occurred in colonies of monkeys kept for research, and hence the name monkeypox. So actually, just the primary reservoir is not primarily monkey, but it is rodents. But why it is called monkeypox is because there were few monkeys which were kept for research, and they were observed to have this pox-like disease. At that time, the smallpox was very predominant in 1950s. So because it was a pox-like disease, it was called as monkeypox, and because it was first discovered there occasionally by the researchers in the monkeys, so it was called monkeypox. So actually it is a misnomer. The first human case of monkeypox was recorded in 1917 in Democratic Republic of Congo during the period of intensified effort to eliminate smallpox. Smallpox was eliminated from the world in 1969 and 70. So everyone was very aware. The search for the pox diseases and the reporting of pox disease was very predominant. And the world wanted, the WHO had intensified their processes to eradicate smallpox. And so every disease was reported. And that is when the first pox-like disease, which was monkeypox, actually reported in 1970, or it was first time identified. So there have been many confirmed cases of the monkeypox in Africa, mainly in the Central and the Western Africa. And in here in purple, you can see in the map that they in other areas also they were imported, but mainly in the Africa. And it was usually an endemic disease. It never came out of except in 2003, where we could see in America. And after that, there have been other areas within Africa where we have seen a lot of endemic areas where these monkeypox cases were recorded. Today in the world, 35,000 cases of monkeypox have been recorded, confirmed from the 92 countries. That this figure is from WHO. In India, we have 9 confirmed cases till date. 4 are from Kerala, 5 are from Delhi. And 98% of the cases worldwide are amongst the people having sex with the same gender, and 48% of them have HIV also. So these figures are again from WHO. So it is seen that 98% of the patients are usually from the people who are having sex with the same gender, or male having sex with the male. Now let us understand what is this virus. It is a double-stranded DNA virus, and it is orthopox virus genus and poxviridae family. This is just medical, these are just medical terms, but just because I wanted to speak a little about virus, so this is the information that I'm sharing. There are two types of distinct clades of monkeypox virus. One is a clade 1 and clade 2. The Central African clade is called clade 1 and a Western African clade is called clade 2. The Congo Basin clade is more severe than and more transmittable than the Western Africa clade. That means the clade 1 is more severe, causes more severe disease and more transmissible. Cameroon is the only country where both the clades have been found, the diseases with both the clades have been found. But more or less, they present in the same way. Let us see how does it get transmitted. But it primarily affects the animal and typically the rodents, and by the scratch, by the bite, by the urine, or the consumption of the bushmeat or the died animals of the South Africa. Then from there, they get transmitted to the human being. So it is either by the infectious rash, scab, or the body fluid from the animal or from the human beings. And the respiratory secretion, the large droplets means if when you cough, when you sneeze, when you speak, if the large saliva spots or the droplets come out of your mouth or your nose, they can transmit the disease. So typically the large droplets do not travel more than 3 feet or maximum 6 feet. So this transmission is not as bad as it is seen in COVID. Touching the items that were previously touched by the infectious rash or the body fluid like towels, your clothes, and also bed sheets, bed covers, your quilts, all of these can also transmit the disease. Pregnant people can spread the virus from mother to fetus and through their placenta. So who's at high risk of catching this disease? It is the household or the sexual contact with someone who's suffering with monkeypox. Housekeeping people, if they're not wearing gloves or a PPE kit, they are known to get infected. Current risk factor for contracting monkeypox also include travel within 21 days to an area where monkeypox cases or exposure have been reported. The travel history here becomes very important, and especially if people are coming where dominantly this disease is seen, especially in Africa, then this history becomes very important. And if you have a patient or if you have someone who has features which are suggestive of monkeypox, then it should be looked into, the medical person should be contacted, and medical opinion should be taken. Contact with a person who has a similar rash or a diagnosis of a confirmed or suspected monkeypox, and sexual partner of the diagnosed or suspected monkeypox patient are at a higher risk of contracting this disease. If we come to symptoms, if I just grossly tell you the overview of the symptoms, then initially there is an incubation period. That means if you have come in contact with someone who has monkeypox, then up to 21 days, there are chances that you may show the symptom of the disease. The febrile stage, the fever starts and lasts for 1 to 4 days. And here there is fever, there are some swelling in the neck, which we call it lymphadenopathy. There is headache, there is chills, sore throat, there are myalgias or malaise, that means body pain, and there is easy fatigability, or the person gets tired easily. Then the rash appears from day 2 to 4 weeks anytime, and there are various stages of rashes. I'm going to tell you what they are. And up to the 4 to 6 weeks, the patient recovers. So as I told you, there is high-grade fever, there is headache, there is swelling in the neck, or it is known as lymphadenopathy, there is backache, there are pains there is pain in the body. There are various stages of rashes like macules, papules, vesicle, pustules, or crust. So these are various papules, or they are raised lesions. Then vesicles, that means they are fluid-filled lesions, then pustules, that means they are pus, filled with pus, and then they finally have a crust on them when they heal, and then they dry up. So these are the things that, these are the rashes, and these are the stages that the rash go through in the monkeypox. Actually, skin lesions also decide the severity of the disease. If the disease is benign, then the lesions are there like almost 25%. There is oral involvement, and there is ocular, that means eye involvement. Around the eye, there is lesion. In the moderate disease, the lesions are up to 100. Plus eye involvement. In grave disease, the lesions are up to 250, plus the lymph nodes or the swelling in the neck or the lymph nodes are enlarged. And if it's a very severe disease, then it is more than 250 lesions with lymphadenopathy and with complications. So here you can see the various vesicles or the fluid-filled lesions throughout the body of a child. And if you typically see the lesions on the palm, so in other diseases, you don't see the lesions on the palm, whereas here you see along with other parts of the body, there are lesions on the palm, which are very typical of the monkeypox. So where are the what are the other diseases which we can actually get confused with monkeypox, where you have a similar kind of a rash? So similar kind of rash is seen in chickenpox or measles. Let us see what is the difference between these three diseases, and how can we understand, how can we differentiate between these diseases based on the rash and other symptoms. So fever is almost for 1 to 3 days or 3 to 5 days in all the diseases. The rash appears in the first stage of the development in monkeypox. And there is one, the rash gradually increases in monkeypox, whereas in chickenpox, there are multiple stages of development. That means you will see the rash in a red rash, a papular rash, the vesicles or the fluid-filled rash, or there may be pus, or there may be a scab. So in chickenpox, you will see all the stages in one person, whereas in monkeypox, the rashes all over the body will be in one stage at a given point in time. In measles also, often in multiple stages of development, but you do not often see vesicles and pustules in measles, but you see more of macular and papular rashes. The rash development is slow in monkeypox, is rapid in chickenpox, and is very rapid in measles. The rash distribution in monkeypox is mostly on face and then palms and soles. So palms and soles is something which is very typical of monkeypox, and that's when you should suspect. Chickenpox, it is dense on the trunk and absent on the palms and sole. So if it is not there, the rash is not there on the palms and the soles, then it is not chickenpox. It is there, it is not there, then it may be a chickenpox. And measles, it starts on the face, spreads sometimes reaching the hands and the feet. Another disease in children which we can get confused with a rash is a hand, foot, and mouth disease. Here you can see the vesicles present on the hand, on the tip of the fingers, on the hands, and in the mouth. In India, it is usually seen in children, and it is rarely seen in adults. And it is associated with the fever, and the rash disappear very fast in hand, foot, mouth disease, whereas in monkeypox, the rash takes time and goes through the stages of development. Coming to the lymphadenopathy or the swelling in the neck or in the underarm, in your armpits or in your inguinal area is present in monkeypox. It is not there in chickenpox, and it is very, very occasionally seen in measles. Death rate is up to 10% in monkeypox because of the complications. Rarely you see the chickenpox encephalitis or death because of that. And measles, in the outbreak, it varies whether you can. It's not that you do not have a death rate in measles, but it is much less than what we see in monkeypox. Now let us come to the investigations. The PCR, all of us are aware of the PCR test after the COVID pandemic, and it is a confirmatory test for the monkeypox as well. It can be done by a NAT or a nucleic acid amplification test, or it can be done by a viral DNA PCR. It can be done alone or it can be done with a sequencing. And Roche was the first company to develop a PCR test for the monkeypox. Trivitron from India has also developed a PCR kit. And the rapid tests which are available, the antigen and the antibody test, actually the orthopox viruses have lots of cross-reactivity. Because of this, we do not get a specific information for the orthopox viruses. So the best is to get a PCR done, then getting a serological test done. For PCR, the viral swab is taken from the vesicles or the ulcers. So these are from the skin rashes or the fluids from the skin rashes which are coming out. From there the swab is taken, or the dry scraping of the scab. When the rash gets dried up, a scab is formed. From there the scraping is taken, and that is sent for the PCR test. So it is important that we take a right kind of sample and we send for the PCR test. Like in COVID, we used to take a nasal and the throat swab. Here it is taken from the rashes. What are the complications in the sequelae that can happen? There are lots of complications which we can see, and it is more common in the people who are having comorbidity and who are immunocompromised. Comorbidities like diabetes, hypertension, heart disease, kidney disease, any cancers, or people who have had their transplant, they are on immunosuppression, or any other autoimmune disorders who are on immunosuppression, then they can have this severe disease of a monkeypox. This may be because of the skin infection which gets spreaded. They can get secondarily infected. There may be pneumonia. There may be sepsis. There may be involvement of the brain causing encephalitis. And if it affects eye and if the cornea gets affected, there may be a loss of vision. The treatment, actually, there is no safe or proven treatment for the monkeypox yet. There are antivirals which have been approved by FDA, but they are approved on the basis of animal trials, and only the phase 1 trial in the human beings. That means the healthy volunteers have been given this treatment, and they have just seen the levels in the blood and the side effects. There has been no head-to-head comparison trial with these treatment in the patients of monkeypox. One, because it is this is an endemic disease, it is not seen commonly, so the trials were not done, although the trials were planned, but it could not be done. So tecovirimat is an antiviral. Then brincidofovir is another antiviral which is being used, and it is available in use for 1996. Cidofovir, this was, although was approved by the CMV or cytomegalovirus retinitis, but it has been tried in patients of monkeypox. A smallpox vaccine can be given for the prevention. Geneos is approved for the prevention of monkeypox disease for more than 18 years of age, and there is another vaccine by the Aventis Pasteur, or known as Aventis Pasteur smallpox vaccine, which is approved in the Europe, and it is available, which is said to be preventive in the monkeypox, not for the treatment, but the prevention of the disease. So who should get prevented? So how should we practice prevention? One is that isolate an infected person from the others who could be at risk. That means immediate family, immediate spouse, or a partner should be isolated. Practice good hygiene. Of course, the sanitizer doesn't go out as yet. We have to use the sanitization, good sanitation and hand washing practices. Avoid contact with the animals that could harbor viruses, especially where the monkeypox is endemic. Avoid direct contact with any material which has been used by an suspected or an infected confirmed patient of monkeypox. Then use a PPE, always use PPE, gloves, and the mask while taking care of patients who are suffering from monkeypox, and refrain from using a product such as creams, powders, and lotions which are made from African wild animals. This is very, very important. Now, what are the headlines which are going around about the monkeypox? One is that 8 Indian companies have shown interest for vaccine development to the ICMR. ICMR had called proposals for the vaccine development, and 8 companies have shown some interest, and 31 companies have shown interest in development of diagnostic kits. We have to, and the good news is that, and we have to understand that this is not easily transmittable. So there is going to be no lockdown because of the monkeypox spread. So which is again a good news. Roche developed 3 kits to detect monkeypox. US government has ordered a lot of Jynneos vaccine in advance, as it has been done earlier also by the US government. Moderna, which was the first one to come up with the COVID vaccine, has also started clinical trials on the monkeypox vaccine. No mass vaccination is required as it was required in COVID for monkeypox. This has been said by the WHO. They say that isolate a person and contact tracing would suffice for monkeypox. We do not need any mass vaccination. Although the Denmark is considering vaccinating close contact of monkeypox patient, not mass vaccination, but close contact of monkeypox patients. Now, what is the carry-home messages? Monkeypox is expected to spread much more than what we are seeing now, but it is of course not like COVID-19, and we need to learn to tackle it. The role of sanitizers and PPE kit for the people who are in contact or who are the healthcare workers is very, very important. There is no anti-monkeypox treatment or antiviral which are like directly proven to be 100% effective. The treatment is according to the symptoms and prevention of the secondary infection, and fluid balance and that means not cause any dehydration in the patient. This is the mainstay of the treatment. Smallpox vaccines can be used for prevention purposes. Disaster management and good global health security should be in place. That means every government should be in touch with WHO to understand what are the processes that one should be following, and should also have a country-specific guidelines to tackle the outbreak of monkeypox. Government of India has already released the guidelines to tackle the monkeypox patient and how to treat it. And India, being a powerhouse of vaccine development, will again have to come to the rescue to the globe and need to be very quick in action of vaccine development. So again, people are looking towards India for the vaccine development in terms of as it was seen in COVID-19. Thank you. So that's all I would like to add, and I'll be happy to answer any questions regarding this.
Hi, ma'am. So, doctor, are you able to read the chat so I can take up questions in the live chat and paste it here?
Yeah, I have just seen that. Is there any possibility of transmission of monkeypox if the rat has touched any eatable item, which is normally at home? So first of all, if the rat is infected and if they have touched or eaten, or they have been, roaming around in a house, if there are secretions of the rat, then yes, the secretions of the infected rat, if you are touching it or if you are using anything which has been touched by the rat and there is an infected secretion of the rat there, then there is a possibility. But if the rat, I mean something which is washed, something which is cooked, then it is not, this is not transmissible. Small babies, how can we protect ourselves and how can we protect the small babies? One is that whenever you are going to the public places, use mask. One is this. Another is that we should always use sanitization, and we should always report a case if we see of any person who's having a pox-like disease or someone with the rashes and fever. It should always be reported. Small babies are usually going to get this disease either from the parent or someone who's taking care. So if an adult gets the disease, then only the small babies will get disease, or a fetus can, or the immediate infant, one, the mother is infected, then only the infant will get the disease. So this is how the small babies will get the disease only if the parent is infected, or someone who has had a raw meat or something, which is more likely to cause disease in small babies. But till date, whatever spread is seen in the world, the age is up from 20 to 50 years of age. It is not being seen in children outside Africa. It is being seen only in Africa that the small babies or the children are getting affected. Oh, I just answered this question. How can we avoid getting infected? Is that wash your hands, sanitize your hands. Avoid. I mean, someone who has sex with the same gender, or men having sex with men, is more commonly seen getting affected. So if that kind of a population is there around you, then yes. And when there is a suspicion of an infection, isolate that person. So that is how we can avoid getting infected. And of course, sanitize your hands regularly. Wear a mask if you're in close contact with someone who has fever with rash. So there are few antivirals available in United States, not here in India, which have been approved for the smallpox and the monkeypox, but they have not been proven. They are not very. They have been given approval on emergency basis, or they are called as animal trial approval. That means they were tried in animals. They were approved. They have seen that there is a response in animals, but they haven't been tried in the people who are infected with monkeypox. They have been in humans. They have only been tried in healthy volunteers. That means someone who has not had the monkeypox, but they were healthy and they wanted to volunteer for this trial. And in them only it has been studied. It has not been studied in people who have had monkeypox. So although it has been approved by the FDA of US, but we do not know whether it will be useful or not. As far as vaccine is concerned, vaccines are always used for prevention. They say that smallpox vaccine, because it is of the same group of viruses, it will help in prevention. So there is a recommendation of giving the smallpox vaccine to the people of contacts of the people who have got monkeypox. So in India, if I say that there has been only one death out of 9 patients who have got affected, I'm answering to the question, is monkeypox deadly? It is usually because of the secondary infection, the monkeypox affecting eyes, monkeypox affecting skin and causing sepsis and septicemia. Then there is a death, and if it travels to the brain, then there is a death. So the complications, if the person gets complicated, then yes, there are chances of death, and the chances of death are almost 2 to 4%, not more than that. The next question is, how do we know when to consult the doctor? So if you have fever and rash, particularly when you have a rash which is rapidly increasing, it is there on your palms and on your soles, in the hands and in the lower part of your feet, and if it is there in your mouth, it is there on your in your eyes, then you should immediately contact the doctor. Before that, if there is any headache, fever, backache, and there is severe muscle pain, then also you should be consulting a doctor. So 1 to 3 days, there is only fever, and then 3rd day onwards, we see that the rash appears. So if we see any rash, fever with rash, please consult your doctor. Is it worse than COVID-19? No, it is not worse than COVID-19. It is COVID-19 is a pandemic, very easily transmittable, and it is, if it has caused a lot of deaths also, more than what we see in monkeypox. So of course it is not worse than COVID-19. It is not easily transmittable, so it will not lead to any lockdown. But here all of us need to be aware of the disease, the symptoms of the disease, and we still need to isolate and treat the person who has the disease. So next question is, when we can say the person is now cured and free from the pox, how long does it take to get cured? So when the rash, which is completely dried up and even the scab is come out of the body, that is when the person is completely non-infective. It takes 3 to 4 weeks to get completely cured. Okay, so when we do not have any further question, thank you. Stay safe, stay healthy.